Do you do endo treatments on your own? अपने आरसीटी खुद से करते हो आप, बट कभी कभी कॉम्प्लिकेशंस हो जाते हैं ना. तो व्हाट आर द मोस्ट कॉमन मिस्टेक्स व्हाट वी डू while doing an endo treatment? Let me tell you. Now, these common mistakes everybody makes, but we have never thought of compiling it in this form. So I'll tell you common mistakes, top common mistakes, what we do during our RCTs, which we should avoid, which can improve the quality of your treatment. Number one, instruments. We tend to use the same instrument 20 times, 25 times, 15 times because the company agent has told you, sir, ma'am, this instrument is going to last for like 20 RCTs. You can do it. Don't do that. Okay? Don't do that because every instrument has a fatigue. Ideally, those instruments are made for single use. Why are we doing it for 20 times in India? Cost, right? How much does a file cost? One full packet costs around 1500 rupees. Why not add it to the cost of the treatment? Take that money from the patient and use only one file per tooth. That makes a lot of sense because this will eliminate the instrument separation का problem. Instrument separation होता है, सबसे होता है, but क्यों होता है? Because we use the same files again, again and again. Stop doing that, guys. I'm not saying एक instrument को आप एक ही patient पे use करो, but yeah, for 15 and 20 is like huge numbers. You can't do that. It's practically impossible. Those guys are fooling you out to sell their products. Don't do that. That's the first mistake. Second mistake, access opening. We make two mistakes while doing access opening. Number one, we destroy the whole tooth structure. We make it huge opening. Guys, this is an era of preservation. Preserve and preserve as much as possible. Preserve the healthy enamel. Don't cut out everything. Number one. Number two, I have seen a lot of juniors, lot of colleagues, while they are doing access opening, either they are too shallow, they just go into the pulpal horns and they think that they have found the canal. Pulpal floor is still intact. You just perforate the pulpal horn, your file goes through it, but the pulp chamber is still intact. Don't do that. Secondly, when so many practitioners don't get those canals, they try to use the burrs deep to find those canals. And what happens? It creates lots of ledges, lots of pseudo canals in the pulpal floor. Don't do that. How to find canals? If you are not able to find a canal, always take the help of CBCT. CBCT is a very important tool in finding the canals if it is required. But don't create those new canals using a burr. Don't dig it. You will never find a canal and you will end up spoiling the tooth. Two of the biggest mistakes. And then the third mistake. Everybody does a beautiful BMP, beautiful obturation. But what about chemical prep? Hyposol. We don't give so much of time with hyposol. We need to irrigate it because what hyposol does, go back and read it. This is very important. Hyposol is very important in BMP. And then once we finish the RCT, we just do a temporary restoration and do the crown prep. We don't even think about doing a fiber post, doing a composite restoration. Maybe we don't have time. Maybe we don't take enough money from the patient. Maybe we don't think about it. But guys, the accurate way is after the endo, call the patient after 3 or 4 days, place the fiber post if required, do a very good composite because marginal leakage is the cause of 90% failures of endodontically treated tooth. Why to leave that coronal leakage? Seal it, seal everything. We don't want any leakage. You have done a good endo. We want it to survive for at least 10 years or more than that to do a composite restoration. And the last mistake what we do is whatever the tooth is, we just cut it, make it a stump, and we try to do a crown on top of that. There are a lot of other options, guys. This video is not a platform to discuss all those platforms, all those techniques, but I'll give you a hint. There's something called onlays, inlays, tabletops. It's a whole new world which will give your patient a lot of satisfaction. It will save a lot of natural enamel and it will give you much longer lasting results, especially in the premolars where we do a crown and it comes out cut, fractures. after a few months or a few years. Why? If we follow the simple principles of fiber post, good coronal seal, and choice of crown, inlay, onlay, or tabletop, everything changes. Your endo becomes much better, 100 times better, I would say. So, guys, what are you waiting for? Either you take an advanced training in endo or follow whatever I've said, study about it, research about it. If you want any help, I'm always there. Just drop a DM. See you guys till the next video.